So hello, everyone. Good afternoon. Welcome to our Lunch and Learn on artificial turf, or as we call it, going plastic instead of going green. My name is Adrienne Esposito. I'm the Executive Director of Citizens Campaign for the Environment. This program is co-sponsored by our wonderful partners at PEER, which is the Public Employees for Environmental Responsibility. They're a national organization that we've partnered with many times to work on environmental and public health protection issues. We have a terrific panel with us today. I'll introduce them each as they are preparing to speak. Just a couple things, quick things. One is that we'll be using the chat function. So if anybody wants to join in and make a comment, please put it in the chat. If you have a question, please put it in the chat. We will have room for question and answer time at the end after the three speakers go. So please don't be bashful and put your questions and commentary in that chat function. Thank you. So today we're going to talk about artificial turf. Many of you may remember that artificial turf burst on the scene not that long ago. And there were lots of promises that were made. It would be easier to take care of. You know, you don't have to mow it. That actually is one promise that was true. You actually don't have to mow it because it's plastic. Claims were made on why we should all switch to artificial turf instead of using regular grass. Things were said such as it would be cheaper, it would last a long time, they were safe. You could draw the lines on them so there wouldn't be any quarreling over, you know, the fields and the plays because all the lines would be perfectly even. Grass was messy, said no teenager ever in the history of teenagers. It was less, you know, less expensive for the schools, so on and so forth. So today's forum is about comparing those promises to reality. And I think it's really important to do that because artificial turfs have really become very abundant. We had a staff researcher work to see, for instance, just how many are on Long Island. And the best that after weeks of research, we've compiled a list of over 135 artificial turfs across Long Island, whether it be on high schools, colleges, private parks, municipalities, and other playing fields. So they really have become ubiquitous across New York, Connecticut, and other areas around the nation. So we want to present to you, what have we found in the last decade or two since they've been used so much? We now have good data, good science, and good information that we want to bring to you so we all can be better informed about, should we continue down this road or should we abandon ship? I think you'll find by the end there's some very good features to using grass, all natural, nature grown, Mother Earth approved grass for our kids to play on. But without further ado, I'd like to introduce a PhD scientist, Kyla Bennett, who is the Director of Science Policy for PEER. And she's going to talk to us today about those myths and about the reality of using artificial turf. Dr. Bennett, it's all yours.
Thank you so much. Let's see if my PowerPoint comes up here.
We know it will.
Nope, that's Monica's.
Yep.
There we go. Okay, thank you so much. Today, I'm going to be talking about the myths associated with artificial turf. And this picture is an artificial turf field, and that is shedding microplastic grass. Next slide, please. So let's start with the basics. What is artificial turf? Basically, artificial turf is at least a 3-layer system. It's got the carpet, which is those fake plastic artificial grass blades. It's got a backing, sometimes woven, more plastic. And then it's got what we call an infill. And as you can see in this picture, the infill is what kind of keeps the blades upright and keeps the carpet flat. Oftentimes, many of these artificial turf fields have a shock pad underneath, which is kind of a squishy, more plastic pad to keep it so that when kids hit their heads, they don't get concussions, but that still happens. Next slide, please. So the bottom line is, I'm going to give you the conclusion right now so we don't have any doubts. Artificial turf is bad for the environment. For decades, all of these environmentalists and NGOs and scientists were focused on the infill because most municipalities and private places used crumb rubber infill. And the crumb rubber is simply ground up tires from cars. And EPA really pushed companies to use this crumb rubber infill because it was they called it beneficial reuse. And it was a way to get rid of all of those tires that we get rid of every year off of our cars because they're banned from most landfills. They can cause really toxic fires when they're put there in their entirety at whole tires. They get water and they become mosquito breeding areas, but it's also that tires have a lot of toxic stuff in them. So we were so distracted by the crumb rubber and the toxicity of this crumb rubber that we were kind of ignoring the rest of the artificial turf, the carpet and the backing. Next slide, please. So crumb rubber is dangerous. It's got PAHs, it's got a bunch of metals like lead and cadmium, it's got volatile organic compounds, plasticizers, flame retardants, carbon black nanotubes, which are very similar to asbestos, all sorts of awful chemicals, many of which are carcinogens. And so a lot of people are moving away from crumb rubber for this very reason. Next slide, please. Also recently in 2021, a paper showed that chemicals in tires and the same stuff that's in this crumb rubber killed coho salmon in the state of Washington. And a 2022 paper showed that it had the same effects on rainbow and brook trout. So what we know is that this crumb rubber, when it gets into our waterways, and trust me, it does, it will kill fish. Next slide. So because the industry is moving away from crumb rubber, they're using what they call organic infills. And this is greenwashing. There's nothing organic about it. When people hear the word organic, they think, oh, you know, it's no pesticides, it's all natural, it's healthy. And they are, for the most part, natural infills like walnut shells, coconut husks, engineered wood, but they also do ground up sneakers, cork, and silica sand. And we're finding a bunch of toxic chemicals in these new organic infills as well. Next slide, please. But the infill, it turns out, is the least of our worries. And somebody could use organic tapioca and these things would still be dangerous. And the reason is this. In 2019, Pure discovered that artificial turf contains per- and polyfluoroalkyl substances, which is also known as PFAS. This is a class of thousands of chemicals. They're nicknamed forever chemicals because it's very difficult to break them down. They're all persistent for decades or longer because of the carbon-fluorine bond that all of them have. Many of them bioaccumulate. All we have studied are toxic. Next slide, please. Earlier this month, EPA issued interim health advisories on 2 of the thousands of PFAS chemicals. The 2 that they looked at were PFOA and PFOS, and they basically said that there is virtually no safe level of these 2 compounds in drinking water. No safe level. They were talking about parts per quadrillion, and we can't even measure that low. We have found both PFOA and PFOS in artificial turf. There are basically 3 routes of exposure for PFAS. You can inhale it, you can dermally absorb it, and you can ingest it. And all of those routes of exposure are available when it's on an artificial turf field. Next slide, please. The most concerning thing to me is that this PFAS will leach off of the artificial turf fields into the water. Dr. Graham Peasley of Notre Dame University has tested literally dozens of samples of artificial turf, and he has found PFAS in every single one. Real world examples in Connecticut, in Massachusetts, and in Portsmouth, New Hampshire, all show that the water around artificial turf fields quickly becomes contaminated with PFAS. And in fact, in Martha's Vineyard, a recent study showed that a brand new field will leach roughly 12 parts per trillion of just 6 PFAS off of a new field. And that becomes even more types and more quantity of PFAS as the field weathers and ages. Next slide, please. The other problem with artificial turf is that it sheds microplastics. And if you remember my first slide, my title slide had a handful. Here's another slide. This stuff just breaks off to the tune of about 480 pounds per year per field. And this grass, these little grass microplastic things get shunted into our waterways. Next slide, please. So these microplastics pollute the water, and I like to call them little toxic bombs because each shred of this grass contains all of these chemicals, which is now getting into our water and our soil. And if you've been paying attention to the press lately, you'll notice that we're ingesting, I think it's something like a credit card's worth of plastic every year. And so these shreds of microplastic grass, they contain PFAS. They're getting everywhere. Some fields have had to close because of the drastic microplastic pollution. Diana Conway, the president of Safe Healthy Playing Fields, she has a great quote. "I like to compare synthetic turf to a bad relationship. It gets dangerously hot, it's toxic to everyone around me, and it's unsustainable and really hard to get rid of. You just can't get rid of it." Next slide, please. Artificial turf also contributes to climate change. As you probably can imagine, natural grass fields will absorb carbon dioxide and release oxygen because that's what plants are meant to do. Artificial turf does exactly the opposite and actually releases carbon dioxide, methane, and other chemicals. And in fact, the manufacturing, installation, service, and disposal of 1 2-acre artificial turf field is responsible for the generation of 55.6 tons of carbon dioxide. Next slide, please. So what does industry say? Industry says, but if you use natural grass, you have to use pesticides, and pesticides are bad. They say, oh, it's too drought stricken over here. You have to water natural grass, so you have to go with artificial turf. They say, oh, you get much more playtime, many more hours of playtime with artificial turf. And also the cost. They're saying that artificial turf is cheaper. None of this is true. You can have an organic grass field that you don't have to use pesticides. You can have drought-resistant grass, and you do actually have to water artificial turf fields because of the heat. Playtime, yeah, you might get a few more hours, but not really. If you manage your natural grass field well, you can get the same amount of playtime. And cost, TURI, the Toxics Use Reduction Institute here in Massachusetts, have proven that natural grass is actually cheaper. Next slide, please. So the bottom line is that artificial turf is bad for the environment. There's no benefit to it. The environmental damage that it causes will be felt for decades to come. And although drought and climate change is an issue, artificial turf is not the answer to that problem. Next slide, please. So in conclusion, I'm old enough, some of you may be, probably not, old enough to remember the old chiffon margarine commercials where they said, it's not nice to fool Mother Nature. And in this case, it's so true. We cannot continue to use plastic grass because it's hurting not only the players, which hopefully Dr. Evans will be talking about in just a minute, but also it hurts the communities in which these fields are because of the drinking water, the microplastics, and the climate change. It's just a bad idea all around. Thank you very much.
Thank you, Dr. Bennett. Just one quick question before we move on to Dr. Evans. Where in the artificial turf, this is a question by Alex, do the PFASs stay? Is the first layer, the second layer, all the layers?
So we found them, it's a good question, and we found them in the grass blades, in the backing, and actually also in a lot of the infills. But what we've learned from industry is that they cannot make artificial turf without using PFAS. It's in the machinery, and they also mix it into the hot resin. It makes the blades nice and uniform. It may give UV protection, It makes it a little slippery, which you can tell from the way people slip all over these fields, but it is mostly in the blades, but also the backing and the infill.
Okay, thank you. Okay, there's a ton of questions going on in the chat, but I promise we're going to get to them after our next two speakers. So next, we're delighted to have with us Dr. Sarah Evan, who is the Assistant Professor of Environmental Medicine and Public Health with Icahn School of Medicine at Mount Sinai. So we're delighted to have you, Dr. Evans. The floor is all yours.
Thank you. Is that showing correctly? Are my slides showing correctly?
No, you need to minimize the bottom. You have to have it full screen so they can see it.
Is this correct now?
No,
Okay, 1 second.
this will work. It's
No,
not a
that's-
tragedy.
No, I don't know
Hit
why.
use slideshow.
Just a second ago, it was
Yes, it was.
correct. So I don't know. All right, hold on. Let me try again. Now?
Oh, perfect.
Okay. All right. Well, thank you so much, Adrienne and Kyla. That was a great introduction. So I'm going to take some of what Kyla just presented and put it into the context of children's exposures and health impacts. So I work with a team of research scientists and physicians at Mount Sinai, where we study the consequences of early life exposures on health outcomes later in life. And so one of the central motivators to our work is the fact that chronic diseases are on the rise. We know that all of them have an environmental component, and importantly, many of them have origins in early childhood. So if we can identify and prevent harmful exposures, we can dramatically improve population health. So I'm just going to briefly review why children are most vulnerable to exposures on turf, and some of the potential health impacts of chemical and heat exposures, as well as injuries and abrasions. And then I'll discuss a little bit some of the tips that we provide for safer play when you do have to utilize these turf surfaces. So, of course, we're particularly concerned about turf surfaces and exposures to children. And by looking at exposures across the lifespan from really preconception through old age, we identify periods of life, which we call windows of susceptibility, where organ systems are most vulnerable. Notably, these are periods like during fetal development and early childhood, but also on into puberty and adolescence when reproductive and nervous systems are still growing and changing. So we're even concerned about exposures that older kids and even young adult athletes experience on these surfaces. So in addition to their rapidly growing systems, there are other reasons why children are most susceptible to environmental exposures. They're closer to the ground where they often roll around. Chemicals chemicals settle in dust and soil, and then children will normally put their hands in their mouths or on their faces, increasing their risk of accidental ingestion. They're also less able to regulate their body temperature. And I'm going to talk a bit about heat exposure. So they're more susceptible to things like heat illness. They also breathe faster than adults. So they may experience more inhalational exposures than adults do. So it's not surprising that human biomonitoring studies of environmental exposures show that many of the over 200 synthetic chemicals that are detected in the blood and urine of most Americans are highest in children. And this is shown by studies that the CDC conducts called the National Health and Nutrition Examination Survey, or NHANES. So children, as well as Black and Hispanic participants in these studies, are shown to have higher chemical exposures. And one of the barriers to confirming the safety of the exposures that are experienced on turf is the fact that typical risk assessments, like those that are conducted by the EPA, look at single chemicals in isolation. But we know that we're exposed to multiple chemicals at low doses over long periods of time. And so it's important to look at what the impacts of that is on health. So Kyla already mentioned the three main routes of exposure to chemicals on turf, and she also listed some of the chemicals that we have concerns about. Many of these were identified in the chrome rubber artificial turf infill that she talked about, but we're also finding them in the other materials that are associated with turf, as she mentioned. And so many of these have been shown to be carcinogens, toxic to the nervous system, like heavy lead, heavy metals like lead, reproductive toxicants like plasticizers, and also respiratory irritants like VOCs or particulate matter or silica dust. And those exposures are likely to be affected by things like weather conditions or temperature or the type of activity. So as a child or an athlete's ventilation rate increases, they're more likely to experience higher inhalational exposures. So because of all of these concerns, the US EPA, together with the CDC and the Consumer Product Safety Commission, launched a federal study to investigate the safety of tire crumb, with a main focus, again, on the recycled tire crumb rubber. They have yet to release a full risk assessment or any biomonitoring data from these studies to show what's actually getting into the body when children play. But it's important to note, and this is a direct quote from the report, that they concluded that studies to date have limitations and do not comprehensively evaluate the concerns about health risks from exposure to tire crumb rubber. So when you hear community members or industry argue that these products have been proven to be safe, you can look to the reports from the federal government that really call this into question. We do not have the data that we need to prove safety. We know that these products contain chemicals of concern. There's a good chance that there's a completed route of exposure for them to get into the body, and we don't know what the health impacts are yet. So because of those findings, as Kyla also mentioned, many communities are choosing alternative infills to tire crumb, as the focus has really been on exposures that occur through infills. And so those alternatives include things like virgin rubbers, plastics, sand, or even those organic plant-based or mineral-based products. And so I just wanted to point out two recent studies. One that was conducted by TURI, the Toxic Use Reduction Institute, together with one of my colleagues at Mount Sinai, Homera Harari, which found chemicals of concern, albeit at somewhat lower levels in many of these products, but they did identify many of the same chemicals of concern in all of these alternative infills. And again, no studies to date have really examined what chemical exposures children are experiencing when they play on these products. And as Kyla mentioned, we're starting to look more at the non-infill exposures, and the work that she did with PEER and with TURI have really highlighted the potential for exposure to the PFAS chemicals. And so I just wanted to point out that we have an increasing amount of evidence for the toxicity of this major class of chemicals. And so PFAS chemicals have been conclusively linked to things like thyroid disease, high cholesterol, kidney and testicular cancers. And then more recently, we see that higher PFAS exposure is associated not only with COVID-19 severity, but also with immune dysfunction and decreased vaccine response. So a lower antibody response to vaccination in children who have higher levels of PFAS in their systems. We also see impaired neurodevelopment and poor pregnancy outcomes like low birth weight with PFAS exposure. And so because of this, there have been, to put a positive spin on this, New York and other states have passed legislation to restrict PFAS chemicals in a number of different products. So things like firefighting foam, food packaging, other consumer products. So we're moving in a positive direction towards regulating these chemicals, and yet they're still present in artificial turf materials. And so as Kyla also mentioned, just not even 2 weeks ago, the EPA announced interim drinking water lifetime health advisories for 4 PFAS chemicals. It's also really important to note that these are not regulatory and they're not enforceable. So hopefully this fall, there will be some enforceable limits placed on some of these chemicals. Again, these are 4 PFAS out of a universe of thousands of PFAS chemicals, but this is a step in the right direction. PFOS and PFOA have been reduced for drinking water health advisory limits from 70 parts per trillion to 0.02 or 0.004 parts per trillion. So I just want to point out that 70 parts per trillion was reported to be safe. Now we have essentially no safe level of PFOS or PFOA in our drinking water. And this is a thousands-fold decrease in the permissible level, what we hope will be the permissible level of PFAS. So this is something that's really important to keep an eye on, but really impacts communities that have these products in place in their community that are leaching PFAS chemicals and exposing children. Sorry, this is not, okay. And Kyle also mentioned microplastics. So microplastics are really an emerging concern in environmental health. They're proving to be fairly challenging to study, but we have ongoing studies at Mount Sinai that are attempting to characterize this. What we do know about microplastics is that they have been detected in both indoor and outdoor air, in both tap and bottled water, in seafood. It's estimated, again, that we inhale and ingest something like 5 grams per week. This is a Rutgers image where they attempted to quantify what 5 grams of plastic per week would look like. And what's really concerning, while we don't have the full picture of what the health impacts of these exposures might be, they have been found deep in the lung tissue from living biopsy specimens, in blood, as well as in placenta. So they're distributing throughout our bodies, but we don't yet know the health impacts. There's some suggestion that they are linked to inflammation, GI problems, obesity, respiratory problems, immune dysfunction, and endocrine disruption. So I want to turn quickly from chemicals to talk for a second about heat effects. So we know that artificial turf surfaces expose children to dangerous levels of heat. They absorb solar radiation, but they don't allow for evaporation like natural grass. And so essentially every type of artificial turf surface that has been measured gets hotter than natural grass. And then it's not only the surface temperatures that can be dangerously high, but the air temperature at head height above the field has been measured to be 70 degrees hotter than the air temperature above a natural grass field. And so you can see here from a report that one of my Mount Sinai colleagues, Luz Claudio, published in 2008, looking at satellite images above New York City and showing that the temperature of an artificial turf field was similar to that of a black asphalt roof. So you have what we call a heat island effect created by artificial turf fields, where the entire area surrounding that field can actually heat up. And it's also important to note that watering provides very limited amount of cooling. So it's extremely transient when you water the field to try to cool it down. And a lot of the really good work looking at different types of surfaces and temperature have been done by Penn State. And I just put a link down there at the bottom if anyone wants to look at that original data. These are temperature measurements that were conducted by, again, Homero Harari at Mount Sinai in New York City, showing again how much hotter an artificial turf field and a poured-in-place crumb rubber playground can get when you have fairly mild ambient air temperatures. So, of course, we're very concerned about these temperature levels. Heat illness is the #1 cause of death and disability in high school athletes. Football players tend to be the most impacted, as well as marching bands, as you can see here in these very warm uniforms. They practice for hours during the summer. And as I showed in the previous slides, those high temperatures can actually result in both 1st and 2nd degree burns. And I mentioned that children are more susceptible to heat exposure. They also have thinner skin, so they're at greater risk of skin burns as well. And there's a fair amount of data that supports increased knee injuries on turf. There's greater resistance between the shoe and the turf, which can cause rotational injuries. Abrasions are more common, which can result in skin infections and also potentially directly expose individuals to chemicals through open wounds. This is one of the reasons that the U.S. women's soccer team fought for many years to be permitted to play on natural turf like their male counterparts. And you can see this turf burn on a U.S. women's soccer player, and as well as the turf accumulating in the wound. So you can envision how direct chemical exposures could happen. They ultimately did sue and recently won the right to play on natural grass. We've also seen recent petitions from professional football players to demand that they be able to play on natural grass to reduce injuries and the exhaustion that they find to be greater on artificial turf surfaces. So we often hear coaches and parents demanding that their child have state-of-the-art surfaces to play on, but actually professional athletes prefer to play on natural grass. And I think that's an important point. And Kyla also mentioned climate change, and I think it's really important to think about how These surfaces can indirectly impact health by exacerbating the climate crisis. And we know that there are a number of health impacts that the climate crisis is having. These are giant plastic rubber carpets. They use a massive amount of petroleum to generate. They create heat islands, as I mentioned. They contribute to flooding, which disproportionately impacts marginalized communities. And they also emit greenhouse gases like methane once they're disposed in a landfill. And so lastly, I just want to mention some of the tips that we provide for safer play. This is an example of a sign that was posted in the town of Westport, Connecticut, giving people tips on what they should do to stay safe when they play on the field. So that's one strategy that you can use. We think that individuals should avoid play on hot days. So even though many communities feel that they can increase the amount of play that's possible in wet weather, we would counter that you should be restricting use on hot days. Avoid lounging and passive activities. It's really unfortunate when these surfaces become sort of the only open area for children to play. Clean out cuts, shake out gear. We don't want you to take home all of the microplastics that Kyla mentioned or the chemicals. So shower quickly once you're done and try to avoid indoor fields, which really should be well ventilated. And so we get a lot of inquiries from communities about how to choose a safer playing surface. As the data that I showed earlier shows, essentially all infill and the grass blades and the padding contain chemicals of concern. So our first recommendation is always to choose well-maintained natural grass turf fields. And for playgrounds, rather than poured in place rubber, you can use arsenic-free wood chips, for example. So the Consumer Product Safety Commission makes a lot of recommendations about products that are totally safe from an impact standpoint to be utilized on playgrounds. And so I just want to end by highlighting that some of the greatest successes that we've seen in changing practices and policies come from coordinated efforts between scientists, advocates, and community members, and to direct you to a website that's maintained in part by Mount Sinai, the healthyplayingsurfaces.org site, where you can get more information, as well as some of the information that we have at Mount Sinai. I can put these links in the chat for you as well. And additional resources related to environmental exposures. And so with that, I will end just by acknowledging the work of my colleagues at the Institute for Exposomics Research and our Pediatric Environmental Health Specialty Unit and New York State Children's Environmental Health Center and the National Institute of Environmental Health Sciences.
Okay. Thank you so much. We appreciate it. And if you could put those links in the chat, I think that would be extremely helpful too. Last speaker, but certainly not the least speaker, we have Monica Mercola, who's an attorney. She actually is the attorney for PEER, and we're happy to have you with us today. Monica, you're up.
Hi, everyone. I'm Monica Mercola, and I'm going to be talking about artificial turf manufacturers' advertising practices and what specifically PEER has been doing about them. So just to let everyone know, PEER submitted a complaint to the Federal Trade Commission to investigate marketing practices of artificial turf manufacturers, specifically claims of recyclability. So next slide, please. So we argued that synthetic turf manufacturers advertise with false and deceptive claims in pitching their products as recyclable. So what does the term recyclable mean? The Federal Trade Commission is an independent agency of the United States government whose principal mission is the enforcement of antitrust law and the promotion of consumer protection. And in fact, the Federal Trade Commission Act does in fact define the term recyclable. It means an item that can be collected, separated, or otherwise recovered from the waste stream. Next slide, please. So we, in our investigation, found that there were many vendors, manufacturers, and marketers that claimed artificial turf was recyclable. This is a picture of Synlon. We asked the electronic assistant if Synlon was recyclable. It was responded that both yes, it was recyclable, and it is recyclable as well in the United States. Synlon is not the only manufacturer that said made claims like this. We also found claims from TurfCycle, Playing Surface Solutions, Inc., and Tenkate. Claims such as Tenkate is 100% recyclable, Playing Surface Solutions recycles the material, and Turf Cycle rescues the materials and diverts them into recycle centers across the country. Next slide, please. So the problem is that these claims are false. There is no artificial turf recycling facilities that exist in the United States. And to our knowledge, no artificial turf has ever been recycled in the United States. Now, there are 2 known facilities in the entire world that are able to recycle artificial turf. One is in the Netherlands and one is in Denmark. However, it should be noted that Rematch in December of 2021, the facility located in Denmark, did choose a county in Pennsylvania to be the location of its first North American recycling facility. However, Rematch has no deed or mortgage recorded within any Pennsylvania County Clerk of Records. And to our knowledge, construction of this facility has not started. So there's still no recycling facility in the United States. Since there's no recycling facility in the United States, it's not available to the majority of consumers, and these claims are not qualified to show that. And also the mix of materials, as both Kyla and Dr. Evans mentioned, you have rubber, you have plastics, you have organic materials, you have inorganic materials. All of these materials make it significantly limits, artificial turf's recyclability. And again, these claims go unqualified. So essentially, claiming artificial turf is recyclable asserts an environmental benefit where the benefits are negligible in violation of the regulations. Next slide, please. So not only are these claims false, but they deceive consumers and are unfair marketing practices in violation of the Federal Trade Commission Act. First, as I mentioned earlier, there is a representation that artificial turf is recyclable. This is an objective term. It's not subjective like taste or smell. It's specifically stated in the regulations what it means. It's reasonable that consumers would understand what this term means and rely on it, despite the fact that it's false. Next slide, please. So these marketing practices are also material, which means that they affect the consumer's choice of a product. The strategies employed by these companies make consumers more likely to buy artificial turf because they offer false promises of an environmentally conscious product. Companies make thousands of dollars from the sales of artificial turf when consumers could be using traditional grass lawns. The failure to include the fact that there are no recycling centers in the United States and that no artificial turf has been shipped overseas to be recycled misleads consumers as to its recyclability, and contributes to consumers into thinking that artificial turf is a more environmentally conscious choice than natural grass. This is particularly important to consumers who are trying to support products that are environmentally friendly, and this lack of transparency places a heavy burden on consumers to understand exactly what they are consuming. It also undermines companies that are playing by the rules. Next slide, please. So now, the first thing that I would think about, is that maybe recycling artificial turf isn't even necessary. When you think of artificial turf, you think as something that lasts for a really, really long time. And it was promoted as a really environmentally good alternative to traditional grass. But the problem is that these fields actually only last 8 to 10 years, with most warranties only running for 8 years. So you're constantly replacing these fields at a very high cost. And there are around 13,000 artificial turf fields in the United States. And as Adrian mentioned, there are around 150 fields in Long Island alone. And we add 1,000 more fields each year. Next slide, please. So I think there was a question about this in the chat as well about cost. So a new artificial turf field costs between $700,000 and $1.5 million, depending on the size and material used, versus a traditional grass field costs between 400,000 and 820,000. Replacement field costs for artificial turf cost 360,000 to 620,000, and replacement field costs for grass cost only in the tens of thousands. And next slide, please. So if the turf is not recycled, the question is, of course, what happens to it? And it's not exported to the Netherlands or Denmark, but instead it's placed in a landfill, some storage facility, it's stockpiled, or it's illegally dumped. And in fact, Rematch, again, the facility that had chosen this county in Pennsylvania, was found by Pennsylvania's Department of Environmental Protection to have illegally dumped artificial turf. Next slide, please. So essentially, what Pierre is arguing in our complaint to the Federal Trade Commission is that manufacturers are using unsupported, misleading, and false advertising claims to convince the public that artificial turf is recyclable and therefore environmentally conscious. These deceptive practices constitute an unfair business practice, warranting a thorough investigation by the Federal Trade Commission. And thank you.
So you're saying they don't tell the truth.
That's right.
Thank you, Radhika. Okay, we have an excessively lively question and answer and chat section. So let's get to it. First off, Alex Khan, I don't know you, but I'm going to trust you to unmute yourself since you have a number of questions and comments here. And please feel free to ask 2 questions. I don't want you to, we have lots of folks participating, but if you could kindly just maybe ask 2 of your questions, Alex, that'll get us started. And then we're going to go to the next one.
Sure. Thank you.
Thank you.
Yeah, I guess one of the things was on Dr. Bennett. I believe it was your slide where you had a lot of points, but I didn't see the quantitative data behind it. I think you were just saying the costs aren't that the cost rumors of it being less expensive weren't correct. And there were a couple other points that you had. I was just hoping that maybe you could provide the sources or the quantitative data behind that, as it would be really helpful if possible.
Sure, I think that was Monica's slide actually with the costs. I don't know if you got that from Turi, Monica, or someplace else.
So I got that actually from an industry website, which claimed that that was how much it was going to cost as an estimate. I can send that link around to be sent to everyone at this webinar.
Okay.
Thank you. Alex, did you have a second question before we move on?
You can go ahead at this time. Thank you.
Okay. Thank you, Alex. We have Lawrence, and I'm not going to pronounce your last name correctly, Laforgu. You asked a question. You can unmute yourself and maybe articulate it better than I can from what was printed there.
Hi, everyone. We are in a town where our city council is considering a proposal to replace a natural grass field with an artificial turf, and the site is in a floodplain that is wetland adjacent. And they seem pretty dead set on just going through, and they have support from the parents who think it's a good idea to increase the competitiveness of our town relative to other towns in Westchester. Are there any legal recourse for policing of projects that is so environmentally compromised that we have today? Are there any successful case study of fighting back a town and just not allowing them to do something that seems just so plain wrong from an environmental standpoint, given the fact that it's so close to wetland?
Okay, thank you.
There are examples of towns that have successfully fought back. We're actually about to go to court on Martha's Vineyard, where the planning board denied a permit for an artificial turf field because of the impacts to the drinking water supply. There are also a number of towns in Massachusetts that have issued moratoriums on artificial turf for 3 years, in one town, 6 years, until they can gather more information. But I think depending, so New York, are you in New York? You said Westchester, so you're in New York. So
Yeah.
New York does regulate PFAS in water. And I would think that at the very least, you should be able to get talk your town into requiring that the industry or the manufacturer in the project specifications say that there will be no PFAS. We've gotten other towns to do that. And then that's unfortunately an after the fact thing. Then we measure afterwards and find the PFAS and then fight with them about ripping it up. But if you should look at your local bylaws, particularly with wetlands, look at drinking water issues for the state. It's just nonsensical to put one of these fields anywhere near wetlands, anywhere near an aquifer or a zone 2 of your well or whatever. But I would look, talk to your water department. In my town here in Massachusetts, we put in 2 artificial turf fields over vehement opposition. And within 2 years, our entire water supply was contaminated and we have to pay $9 million for a filtration plant. So, you know, you may want to raise to them the fact that this is going to impact their water supply at some point. And not only that, the way that regulations are going at both state and federal level means that probably wherever they put this field down will become like a mini Superfund site in short time. I mean, we are saying, EPA is saying virtually no safe level of PFOA and PFOS. And what they're doing is putting down acres of plastic that contain those very compounds. They probably aren't aware of that. And
Yeah, and I just want to jump in and don't think for the participant, New York's drinking water standard is 10 parts per trillion. So it's one of the lowest drinking water standards in America. But with these new health advisories that EPA released, it may go even lower. So we can't undervalue what Kyla just said, is that on one hand, we're regulating drinking water. On the other hand, we're putting down more and more sources of the PFAS and PFOA to get into that drinking water. It's crazy. All right, let me move on. So Ted is asking, this is for you, Dr. Evans, is there any data on the growth of autoimmune diseases related to artificial turf?
That specifically has not been looked at as it relates to artificial turf. Most of the studies that have tried to link turf to actual health outcomes have looked at cancer, which, as you know, is a very challenging outcome to study as it takes decades to develop. And some of the studies that have looked at that have looked at different types of cancers. So we don't have data really to link turf to other specific health outcomes. And part of the reason for that is because we don't have the biomonitoring data yet. So we really need to see what is in the bodies of the children as they play. It's such a heterogeneous product, and there are so many different chemicals that it's very difficult to just say, you know, a child played on turf and now they have this health outcome, and to quantify the impact. So we don't know that specifically. What we do know is that many of those individual chemicals that we listed are associated with a myriad of health outcomes. So, you know, the logic is that the way that children interact with those surfaces is likely to lead to exposure. We don't want to have any exposure to many of those chemicals, particularly for a child. And so, you know, our feeling is that knowledge of what chemicals are present there and the way that children are interacting with them should be enough to, you know, at a minimum, put a moratorium on play until we know more about what's really getting into the bodies and what the health outcomes are. And we have a safe alternative, which is natural grass.
Okay, and this is a comment by Harry. Maybe you could just comment on his comment, Dr. Evans. It said the discussion analysis shouldn't be just limited to children, since adults also play on the sports fields. Any comments about that?
That's a question for me?
Yes.
Yeah, I totally agree with that. And as I said, vulnerability continues into adulthood. There are other periods of life where, you know, we become vulnerable. Again, there are individual vulnerabilities. So I talked about windows of susceptibility, which are based on age, but there are things like comorbidity or genetics, or other types of exposures that you might have. Stress, for example, exacerbates chemical exposure. So there are other individual susceptibilities that would put adults at risk. Often these conversations center on children. And we do know that that's a vulnerable period. We also, children have more future years of life ahead of them to develop diseases with long latency. So that's why we tend to focus our conversations on children. But I should say that in environmental health, we are taking more of a lifespan approach to think about exposures and diseases across the lifespan. So that's totally valid. And I agree with you that we should be addressing that more.
Okay. Next question, actually, Emmett Pepper, Councilman, do you want to take yourself off mute and ask your question?
Yeah, thanks, Adrian. My question was about the EPA study about crumb rubber, and I guess it also, as we talk about PFAS, how the EPA, that study interplays with that. But as I understand it, there's a two-part report, and the second part of the report, which will have conclusions, will be in some undetermined time in the future. And just curious, we enacted a limit to our turf here in West Virginia that at the city of Charleston that would say that once that second report came out, then we would pause new turf installations. And so I was just curious what your thoughts are. Was that misplaced to focus on that report, or are there other reports that we should be focusing on? Thanks.
Kyler, I think that's for you.
For me?
So, I mean, I'd love to hear Sarah's input in this
Oh,
as
I'm
well,
sorry.
but
Sorry, Sarah.
I think, you know, that the FRAP, the federal report that came out was focused solely on the crumb rubber infill, which, as we said, a lot of people are moving away from. I don't think it was an adequate study. It left out a lot of the health impacts. It didn't look at the mixture impacts of all of the different chemicals. But again, we're so far beyond just the crumb rubber now that we know all of the toxic chemicals that are in the artificial turf blades, backing, and shock pad, that it's kind of moot at this point. I mean, I'm still stunned when towns are still putting forward proposals to use crumb rubber. I thought we should be far beyond that by now. And it boggles my mind that towns are still pushing this. But EPA is supposed to be working on that second part of it, but I don't know when it's going to come out or how helpful it will be. And I'm sure Sarah can say more about it than I can.
Not really. It's kind of a mystery, Kyla. It was, delayed during COVID. They had intended to do biomonitoring studies. And so a lot of that in-person analysis, I think, couldn't happen. So we're still waiting, and I don't have an estimate on when that will be available, but I agree that we need analyses beyond recycled tire crumb.
Okay, thank you. Thank you, Councilman. Okay, Patricia has a good question here. Most towns consider installing artificial turf fields because communities in their sports and social networks have the fields, and their sports leaders argue that the fields are necessary to remain competitive. But do we have any proof that practice on those fields is either better or worse for the competitive edge?
I don't think that exists. I think it's one of those myths. Give my town as an example. We've had artificial turf since 2009. We have 2 New England Patriot players as coaches, and we have yet to send a football player to a Division I school for football. So, that's anecdotal, but as Dr. Evans said, there are the NFL is trying to move away from artificial turf because of the injury rate. They don't like playing on it. So I don't know what's different about high school and professional football, but honestly, I don't think they have any data to say that you're more competitive on an artificial turf field, and you should push them for those data because they don't have it. And what the industry always does is they say that if there's an absence of evidence, they equate that to the evidence of absence. In other words, if there's no studies saying it's not safe or it's not better, then they'll say it is safe or it is better. And that's not the way things work.
Right, that's a good point. You should put the burden of proof on them to prove that statement instead of us looking for data to disprove it, because it's just a myth. I'm going to let Representative from Connecticut, David Michelle from Stamford, Connecticut, jump the line a little bit since you are a state rep. Just kindly unmute yourself and ask your question.
Oh, I certainly don't want to pass in front of everyone. I wasn't.
That's all right.
Thank you.
We know you well.
I had a quick question. Which branch of the EPA are you dealing with? Is it the materials compliance, like Denny Dart, who is the bureau chief at the EPA? And is it stormwater, or is it a complete different branch of the EPA? Or
yeah, so right now so Denny does NIPD's permits, and yeah, point source discharges, water quality stuff at EPA Region 1. But right now, EPA does not regulate artificial turf in any way, shape, or form, nor do they regulate, as Sarah pointed out, any PFAS yet. There are, as EPA doesn't even know how many PFAS there are. There are somewhere between 6,000 and 12,000, according to them. Some scientists say there are more than 1 million. We don't even know. They don't even, EPA doesn't even have a standard definition for it. And they only have these health advisories. They don't have any regulations yet. They're coming this fall, and probably only on 2 or 3 PFAS. So EPA has absolutely nothing to do with this at this point, but its headquarters and the Office of Research and Development down in Research Triangle Park that's doing the studies.
Thank you. And I hope someone from the city of Stamford was listening. This is great. I'll make sure to pass on the presentation. And also just a quick anecdote on Sinlon. They're very funny to deal with when you call them. You can call Sinlon and try to ask any information. You're talking to people who just take messages. That's it. You're not talking.
That's part of the technique, is that they specifically don't have people who can answer your questions when you ask a good question.
Yeah. And I did try the chat today because I saw the picture. No answers. It just kept asking. I don't understand what you're asking. That's very disingenuous company.
Thank you. Quick question for Kyla. From Jill, what Massachusetts town do you live in? She feels that the example that you raised about the contamination to the drinking water supply and the $9 million is a very critical example that they would like to use.
I live in Easton, Massachusetts, and of course we don't know where our PFAS contamination came from. I cannot drink my water or take showers in my water. We're building this filtration plant that will be ready in about a year. The consultant who looked into it thought that our PFAS contamination was from possibly pesticide use, because there's PFAS in pesticides, and also from septic systems and wastewater treatment plants. I am trying right now to get them ripped up. It's anecdotal information. We can look at a map and we can see that the wells closest to our artificial turf fields are the ones that are the most contaminated. But the studies just aren't there yet.
Thank you. Just to repeat this in the chat, someone said, well, they were told by their artificial turf company, or the community was told, that the artificial turf can be shipped to Thailand to be recycled. Kyla's response is, it isn't shipped to Asia to make furniture. It's shipped there to be dumped in the middle of nowhere. So at least the company was half correct.
Well, you also have to think of the environmental impacts associated with shipping. Yes. I mean, this is heavy stuff, shipping it across the ocean. Think about the greenhouse gases that are emitted to do that. It's nonsensical from a cost standpoint or an environmental standpoint.
And what about the playtime? A lot of people are talking about one of the things they get a lot from their, municipality or their local park is that it increases playtime. But doesn't the water kind of puddle on them?
It can. It depends on the field. So I would urge you all to look at TURI, the Toxics Use Reduction Institute in Massachusetts. They have a webpage on, actually, Monica, maybe you can throw it in the chat while I'm answering this. They have a whole page on cost and playtime and things like that. And the playtime, you know, if an artificial turf field is well constructed and well maintained, which very few of them are. One of ours, brand new, within a month of it being put in, there was a rainstorm and it had puddles all over it. So it really depends. But the bottom line remains that if you have a well-built natural grass field, it can be comparable playtime to an artificial turf field.
Okay, thank you. This is the last question because they're still coming in fast and furious. It's going to go to Melanie. Is there an if you rip up your artificial turf, do you happen to know, will there be any soil remediation that needs to take place before a natural turf is laid down? And I think that's a very, very good question.
It is a very good question, and very few states regulate PFAS in soils yet. Massachusetts is one of them. We regulate 6 PFAS in soils to the tune of 200 parts per trillion, but very, very few towns or states regulate PFAS in soil. So right now, probably not, but if it gets into the groundwater, which it is, as we're learning from Portsmouth and Martha's Vineyard and Woodbury, then yes, you will have to do some cleanup.
Okay. It wants to know, how will we answer all the questions that weren't answered today? I don't know. And we actually had a lot more than we anticipated. Well, let me say this. Everyone who's registered and everyone who's on will be receiving the link to the video of this. It's all been recorded. So we're just going to go through and edit. Give us a day to do that. And I know a lot of you are asking for the PowerPoints, and we will ask each of our presenters if they would be gracious enough to send us their PowerPoint so we can send out either the PowerPoint or the links to them to our viewers as well. So we've just gone a little bit over time, but I want to thank everyone for participating. Honestly, I don't want to pat ourselves on the back, but I have to say, this has been extremely informative, very science-based, fact-based, and informative, I think, for everyone who attended. Good luck in your battles to fight artificial turf, because they are not the answer for our children. They're not the answer for the environment, and they're not the answer for the health and safety of what we love and care about, which is community and raising our kids in a healthy way. So thank you, everyone. Appreciate all of your time. And again, we'll send out all that information.